All right, class. Okay, back at acid base again. Now we're talking about respiratory acidosis, okay? And I've actually written down again, I want you to think about an example of a, pathophysiological disease, like something like a COPD, chronic obstructive pulmonary disease, CNS depression, like, opioid overdose, or where there's a hypoventilation process going on. And so again, you have to think about what's happening. So if you're hypoventilating with your, respiratory rate, then now we're talking about somebody who is acidotic, which means their pH is what? Low, below somewhere like 7.35. However, that's usually opposite because now we're talking about hydrogen ion concentration to CO2, right? So when you drop your pH, now you have too much hydrogen ions, okay? Which means now where does your CO2 fall? Because now you're retaining CO2, right? If you're on a hypoventilation, your CO2 is going to be high. So it's going to be up somewhere above 45. And now, because we are saying this is a respiratory issue where your lungs is the issue, your lungs can't be the one to do the compensation, which means that the kidneys have to compensate. And again, now think from a physiological standpoint, what it is that you want to do. You're acidotic, you have too much acid, too much hydrogen ion, too much CO2. So you would actually have to get rid of the acids, or you would have to secrete or retain base, right? So in other words, what is the kidneys going to actually do now is the kidney is going to either excrete acid or secrete or retain base. So technically, the bicarb will actually go up. So your bicarb HCO3 is going to be, it should actually go up, and it should go up to 20, like past 26 if we're actually going to correct the pH, or it would just go up. I shouldn't actually tack a number to it because we don't know where in the compensation cycle it can go higher than 26 to compensate. But the idea is that if you bring up the bicarb, HCO3, it will buffer the acid and correct the pH. Okay, so as you increase the bicarb, what it does is then eventually it will increase the pH. Thank you, and that concludes respiratory acidosis.